Hi, everybody. Welcome to Outcomes with Kim. I'm Kim Palmer, Manager of Research Projects and Spiritual Health with the Woodruff Health Sciences Center at Emory University. Here with me today is the director of our spiritual health program, Dr. George Grant. Welcome, George. I'm glad to have you here today.
Hey, thanks, Kim. It's a pleasure to be on your show.
Okay. Well, as you know, we've worked together for about 10 years. And for all that time, I've heard you talk about the importance of research for chaplaincy. Can you tell me a little bit about how you came to that position and what that means to you?
Yeah, well, it probably goes back to childhood. I like to take things apart and see if I can put them back together again, but I was not always successful. My father and I used to collect these little miniaturized metal cars, and he got me into wanting to like take all the little parts out and see if we could rebuild them. More often than not, we couldn't do it because we didn't have a schematic diagram or anything to make sense of it. But I've always been, curious about, how things work and the mechanics of, the processes of living. And so I'm still in that business, but it has to do with relationships. And I got my curiosity going back when I was a resident in CPE at Emory University, actually. And during that time, I began to see myself as a leader in the field and what it would take for me to be a leader in the future. So I started to imagine what I would look like 25, 30 years down the road. And such as it is, my dreams and imaginations and fantasies have largely come true. So it's an exciting time for me as I think about, my own instincts about the field, but also, what it is that I see as most valuable in the pursuit of caring for persons who are suffering. And one of the ways in which I felt like would be important is my own preparation. So that's where it started. I certainly, did a couple of years of CPE, and then I was in the parish ministry for 5 years in rural parts of South Carolina, and from there I went to Boston to do a PhD in psychology with also fluency in religious studies. So it was a hybrid degree that married, the study of spirituality as a psychologist. And in that, we were required, in order for the psychology part, required to be empiricist. And, my own work had to be demonstrated as quantitative. And so I got deeply connected to, that kind of preparation and began to then make good sense of how things needed to happen in terms of the field in healthcare, because I was still interested in coming back to healthcare and drawing on some of those studies that helped me to be cognizant, at least, of research trends and so forth. I never really saw myself as becoming a principal investigator, much to the chagrin of some of the folks that, the professors I was working with, one being Ken Pargament, who's widely known in religious coping. He was on my dissertation committee, and Carrie During was my first reader. So I had some very valuable folks along the way as sort of ushering, my own becoming, and then saw myself as becoming a leader of oversight, of ushering, of help to grow, this field that we call spiritual health at Emory. So, some of these origins for me, I continue to live with a sense of excitement. I almost feel boyish at times, in my glee over.
Attest to that.
And, I have seen how things have changed over the course of time, being in the field for a good while now, 30 something years. And I still have dreams about the future, but right now, I'm well pleased that we are quickly becoming evidence-based, in our approaches and in our training. And so it's been, my role to see that we continue to move strongly.
Okay, well, thanks for that. So how did you develop the research program at Emory? Like, what kind of steps did you take? How did you get administrators on board?
Well, that's an interesting story too. I was actually out in Seattle. I was director of spiritual care at the University of Washington Medical Center and Harborview Medical Center, which constituted University of Washington Medicine. And we were a fledgling department. We grew very quickly to be one of the largest CPE programs on the West Coast. And it was there that, I began a relationship with the School of Medicine, having to do largely with ethics and also, the kind of relational qualities that care responders, so I call all health care disciplines care responders, teaching in those areas where we can be most effective relationally. And so I wanted to carry that forward. Again, I was not really growing a research career at that point, even though I'd been prepared for that. But I knew that I wanted to be in a position where I could pursue, outcomes-based research. And, I would have taken it further at the University of Washington even. I really loved my time there in Seattle and had a great experience. But then, I was lured to come back to Emory, where I had done my M.Div and also done the CPE. And the return back to Emory afforded me an opportunity to begin a research program. I was director of research and innovation in the department. And it was during the deep recession that I arrived at. So it was really a slog, just in terms of establishing, studies and getting funding. And I found myself drifting into the other schools of health science to relate to other people and be on a part of their studies. And, utilizing, some of the gifts that I had acquired. But more importantly, establishing relationships cross-disciplinary, in a cross-disciplinary way, and networking across the university, which I felt to be very important. If you were going to establish a rigorous research agenda, then I knew that it needed to be interdisciplinary, multidisciplinary, and that the future funding, federal funding, was beginning to require those kinds of qualities that we need to be about. And so I felt like, even though it took several years to establish, a kind of presence and relationships whereby we could go for some major funding, it was well worth the time. It took about 7 years. And we then were able to establish ourselves by a funding source, the Templeton Foundation, and we got a major grant with them. It was multiple institutions who were part of that experience, and had to do with tending to African-American hospice patients, and how they utilized, spiritual health. And so I was really glad that we'd gotten to that point, but I knew we were just scratching the surface. And it wasn't long after that I became executive director for spiritual health. So then I had responsibility for, research, education, and service. And I knew for us to really go whole hog, so to speak, we had to begin to invest in our resources. And I think I met you along the way, and you had been, I think, a resident in our program, and then you came back and you were a fellow, and I saw something within you in terms of our future and research, and sure enough, I knew about a major funding called Transforming Chaplaincy program, and you applied and you were awarded, and then you got your MSPH in epidemiology, and boy, we were off and running. Along the way, I just kept drawing together folks from other disciplines. And, our lead scientist is a biological anthropologist. Our director of research is a psychiatrist. And you run our research projects. So we've got, a very strong, big, I feel like we're in some ways beginnings, but we've got a lot of maturity and a lot of experience on board in where we are. As far as, getting things started, I'm under the persuasion that, I don't do a lot of sort of hand holding and begging, I tend to be kind of a bold person by saying, this is what we need to do in order to be at the best that we can be. And, Emory has always been a great supporter of spiritual health and the arts and science of our discipline. For over 50 years, we've had professional persons in our hospital system. So it didn't take a lot of convincing. I'm, effervescent and I tend to be a little bit bombastic at times. But I think people began to see us as expanding our role and expanding our relationships with other disciplines. So, we started to invest some hard money into positions because I felt like we weren't going to be able to go for the soft money unless we, had some structure. And so it was important for, we report to the president of Emory Healthcare, and it was important to the organization that we continue to be, a research university and be included in that vein. So it's been, at times challenging, but other times very exciting to be not only welcomed by other disciplines within the health sciences, but also to be collaborative.
Well, one of the things that I always hear you talk about is relationships and the importance of the relationships. And that's reflected in this sort of story of how this all came about at Emory. So one of the things that I'm wondering as well is how you integrate research into the service and the educational components of the spiritual health program. I know that these are all priorities for you. I'm wondering if those things are sometimes in conflict or whether you see particular synergies.
Oh, that's been one of the joys, right? Because we do have a tripartite mission and they feed off each other. I mean, the reason for research and the reason for service and the reason for education, they all are commingled but interdependent. And that's how we've gotten off the ground so quickly. We have, a rather large CPE program, as you're well aware of, and we've been able to make use of, our spiritual health clinicians as subjects as well as data participants, and so that's been a privilege. and we wanted to take advantage of that as being a privilege. The other piece is just an expansive healthcare system where we're counted on, to be a part of the, the teams, and most all treatment areas are important to us. And at times we've had some challenges, to sort of bring along each other. So when you are moving toward what we feel like is an intervention experience, then you're going to have as many people as there are in a program, an understanding about how I operate and how I practice. And everyone's unique in that way. So when you try to do something that may be systematized or standardized, you're going to have some challenges, and you do have to do some training, and you do have to spend some hard moments with each other in appreciating what we can do if we collude with each other in that way. And we've just been fortunate that we've got some top folks that, as educators and service leaders and researchers that are a good blend. If we were putting together an orchestra, we would be, just kicking butt, in terms of playing together. And that's largely for, I think, the reason that we need to see the three working in concert is so that we see ourselves as contributing to the professions, the spiritual health professions, in those ways. And that means that, we're excited about creating new training opportunities and training people in intervention and studying the efficacy of interventions, and really working with other healthcare systems as we begin to study. So, I think it's been, sometimes a three-ring circus, but you can kind of look from the outside, in the stands, and kind of see how they are concentric in some ways, and they work together to achieve what I think is best care. So that's what we're all about. The bottom line is, how can we be at our best with care seekers in the care responding role? And I just love that we're privileged to be in that space.
Yeah, that's fantastic. So, one of the things that I'm hearing in your talk is how many resources that we have at Emory, not only within the spiritual health program, but also in our integration across the hospital and the resources within the university as well, and the connections that you've made. And I see this opening up some real rich possibilities for collaboration and research. Where do you see the Emory's research program heading? Sort of what are the priorities, and where do you see it heading?
Well, of course, we've had some recent exciting, steps that we've been able to make and take. And one of those happens to be federal funding, with the NIH. And Jenny Mascaro, our lead scientist, who again is a biological anthropologist by preparation. She's in the School of Medicine, appointed. And but she was awarded a KO1 award, which is a professional development award through the NIH, and this allows us to have a good experience utilizing the interventions that we've been developing. And so I see us continuing in the federal funding pathway, concurrent with and confluent with looking at foundation funding and growing our efforts at tweaking the interventions that we've been developing. And again, working with other sites around the country and the world. So, when you begin to, look at your research endeavors as being self-fulfilling, then you're in a good place. And I think it really does honor the science of what we're about. I think we've been very good in our history of being about the art of certainly the history of chaplaincy. And we're beginning to taste what it's like to be recognized as evidence-based, which would lead to reimbursement schedules. That's a dream that I have as well. So research, again, I think in at least the way that we're beginning to see ourselves, is very multidisciplinary. So our teams are made up of persons from School of Medicine, School of Nursing, School of Public Health, and of course our department in spiritual health, the educators, and we are all working together along with programs across the university that are not necessarily connected to health science, like the Center for Contemplative Science and Compassion-Based Ethics. That center is our partner as we've been developing compassion-centered spiritual health as a program, as well as an intervention and a training paradigm. So I think anything that leads toward specialization and adding to the credential of a spiritual health professional in order to work in settings that are, high acuity and in need of persons who can be counted on to really make a difference, we want to be there. A lot of our work right now has to do with staff, right? And being care responders to our colleagues from other disciplines. We're certainly in the middle of the pandemic, and that's been something that's been very important for us as all of us are continuing to suffer with the care of patients and each other. So I think that our future is looking at how we not only fit in different ways in the service environment and in the educational world, but also how we go about training ourselves and being change agents with regard to how our peculiar training really makes a difference in the care of people. I can't help but think that our outpatient work is frontier and something that we're getting into right now, and how spiritually integrated psychotherapy as a movement could also make use of our research endeavors. So we're certainly going at it in an amazing way.
Well, that's fantastic. I love hearing your passion as you speak about it. And I feel like we could speak all day. And unfortunately, we're at the end of our time. But I wanted to thank you for being here with us today and informing us, about the history and direction of Emory and your part in developing that. And thank you for your talk. And I hope you have a great afternoon.
Well, thank you, Kim, and congratulations on your show, Outcomes with Kim. That's really cool, and I look forward to being a devotee of yours. Thanks for inviting me.
All right. Bye-bye.
Bye.